Okay. Um, hey. Hello, everyone. My name's Mac, and I'm doing this NREMT review. Um, I just wanted to record some videos to help provide some more information and notes and just make it a lot easier to do this exam. Because I haven't really found many YouTube videos that do this where it's just pictures and gives you the information right up front. Um, so yeah, let's start. We're going to do cardiology and resuscitation. So I'm not professional yet in this. I took an EMT class last year, and I passed state of Connecticut. I passed my practicals, but I've yet to pass the exam, and that's one of the reasons that I'm making this. I'm currently studying to retake the exam in December, which is in a little bit longer than half a month. So this should help me as well trying to teach it to you guys. I'm not perfect, so just let me know if there's anything that's wrong, any slides that you're confused about, because I might be able to explain some of the stuff that I've included. Yeah, so a little bit more about me. I go to the Coast Guard Academy, as you can see. I'm a junior here. Um, NAVARC, that's Naval Architecture Marine Engineering, has nothing to do with EMT, but it's pretty cool. Also, you can see in the picture, um, I'm Achilles International Volunteer, so I help run with people with disabilities, and that's another one things I enjoy doing, just running and doing fun races. So yeah, let's get started. So the first slide I had prepared is a slide about the heart flow. This is a really big part of the exam, and it's from what I've experienced taking the exam already and not passing, is that you really need to have a good grasp on this topic. So I try to make a little flow chart just to make it a bit simpler for you guys to understand. So, first, deoxygenated blood comes in through the cava, uh, inferior and superior, ends up flowing into the right side of the heart, the right atrium, and from that it flows into tricuspid valve. Um, the way that I remember that, because it's a bit difficult to remember the order of the valves. I remember that one because try three, and this on my flowchart is the third, like little part. So that might help you guys remember it if you need to know it. Um, they'll definitely ask certain questions that have these terminologies in it, so it's important to study this a bit more. After the tricuspid valve, it moves right into the right ventricle, pulmonic valve, pulmonary arteries, which are the only arteries in the body that carry deoxygenated blood. And from that, it flows into the lungs. And as you know, you breathe in through your lungs. That brings oxygen into your blood. So that's why I discerned it. I discerned it blue to red. Red in on this flowchart just indicates that it's oxygenated blood. So from the lungs goes in the pulmonary veins, left atrium, mitral valve, left ventricle, and the aorta, which leads into your body. So the differences between the left ventricle and the right ventricle is that the left ventricle brings the blood to the body, and it's the most muscular because you're thinking that it has to bring it to your hands, it has to bring it to your legs, your brain. That needs to have a lot of muscle to do that. So that's the most power. That might be a question that you see on the exam itself. Um, the upper part of the heart, the chamber, is called the atrium. So that's why there's two different kinds, atrium and ventricle. Atrium is just the top part ventricle is the lower part. And then the right ventricle, which is the first part that we went through, that just has a bit lower pressure, and as you can see up here, it goes directly into the lungs. Next stage. So I thought it'd be interesting branching off of that to go from where it goes into the body into the specific different parts of it going away from the heart and the lungs. So it goes into all these things: arteries, veins, and capillaries. So the way that I discern the difference between these things is I just drew these crude little cross sections of what these look like. So the capillaries, it's a very thin single-celled wall. That's why there's only one, and it really doesn't have any of that interior muscle to pump throughout the different parts. The veins have a bit of muscle in the middle, but not as much as the arteries. The arteries, those are the most muscular little tube things that bring blood throughout the body, which is why if it gets severed, it starts to spurt because it has all that pressure. The little blue cross section, that's where the blood's going through, has the most pressure, so it starts spurting, and it has bright red blood. So similarly, or different, I guess. The capillaries also have bright red blood, but it's a very slow flow, and that's because it doesn't have any muscle in it. So you're just gonna get a little bit of oozing. And lastly, the veins, um, sorry, um, have steady flow when you get cut from it, and instead of bright red blood, it's a lot darker. So I had some examples of these. So an artery cut, for example, would be your femoral artery. So that would be this right here. That is the biggest artery in your body. And if you get that cut, you're going to die in a matter of minutes. So it's super important that you apply direct pressure and get a tourniquet on that thing, because it's very easy to bleed out from something like that. Um, Going down from order of severity, from most severe to least severe, we go to veins. So example of veins I have that's on this next slide is it's hockey players getting cut in the neck into their jugular vein. So it's it's just a part that's exposed on a hockey player, and if they fall, can skate right up to it. And an NHL player actually died from this. It was also an arterial bleed, um, but um, I'll show you on the next slide. They have safety precautions for these kind of cuts. Um, Lastly, capillaries. The example I went with was just a paper cut or thick paper cut. Um, you're just going to get some blood out. Sometimes it hurts, but really compared to veins and artery cuts, it's really not that big of a deal. Just put pressure on it. Um, so yeah, these are the videos if you want to check them. Or I only have one video. If you want to check them out. Um, so um, I forget the name. I didn't put it in my notes, but there is an NHL player that did die from this, and it's very interesting read on how they try to treat him, and they also have a lot of different cases of where people survive these kind of cuts. And the example that I have is Minnesota teen who got cut in one of his practices, and they're trying to mandate ways to combat this. And one example is neck guards that they have like this, um, but you don't see as many people wearing them as they should, um, just because they're hot and uncomfortable. But in my opinion, um, it's a lot better to be hot and uncomfortable than have a jugular vein cut. So next part. And I put this because on the flow chart that I showed a couple slides back, I use blue to indicate that it's deoxygenated, and it does look like if you go look at your veins right now that your blood's blue. I remember my cousin would always tell me this. Oh, your blood's blue if it doesn't get exposed to oxygen, but no, your blood's always red. It's just the way that the tissue absorbs the light. So yeah, rule of thumb. Um, Surprisingly, I didn't really realize that till after middle school. So going on to cardiac emergencies. So there's two big types of these, and the one that is the least common, um, I guess I'll go to LHF, which I put second for some reason. But the one that's more common is left-sided heart failure. So this is also known as artery disease, and is caused by the heart's loss of its ability to pump after reoxygenation. So the left side of the heart is weakened as a pump. This can lead to pulmonary edema, pulmonary, as you see from a few slides back, pulmonary arteries go into the lungs, so that is fluid in the lungs. Um, and from this, LHF can lead to RHF, which is right side heart failure. So this can be characterized as kind of like a backup. That's the best way I can think of it. So if I go back to where I had our flow chart, so LHF, if the pump is unable to function and stuff just keeps, it's not pumping as smoothly, keeps getting backed up, you're going to go into the right side part of the heart. And that's going to lead to right side of heart failure. So the difference between right-sided heart failure and left-sided heart failure is that right-sided is less common, and there are also some different symptoms that it can cause, which is pedal edema, which is swollen feet, JVD, which would be distended neck vein. You'd just be able to see the neck vein bulging out, and that's because there's fluid in the veins. Like I said, it's kind of like a blood backup, so you can kind of just think of traffic in that kind of way. So going on to other kinds um, of problems with the heart. We have congestive heart failure. So I included this little graphic to describe what a normal heart versus a congestive heart is. So there's a smaller cavity available for blood. So it's unable to fill as much blood due to the thickening of its chamber. So this makes it harder for blood to pump throughout the body. Congestive heart, you can kind of think of congestion, kind of what I have right now. Um, my nose is congested. I can't move. Um, I can't move oxygen through it as well. I guess that might help a bit. This can cause pulmonary edema, as we said, fluid in the lungs, pedal edema, swelling of the feet, fluid down there, um, shortness of breath, chest pain, and from the swelling, this will cause weight gain. And in terms of shortness of breath, fatigue can also come with that. Um, okay, so I have a little map right here, and I wrote down a note. This is just in the U.S. Heart disease rates. It's kind of crazy to see all of it. To see that it varies based on region, I think is very interesting. It could use a study of its own to see why certain regions are affected more than others. As you can see, Oklahoma, crazy how much different it is um, from Colorado and those other states. Um, in Minnesota, wow, Minnesota barely has any. Um, it has some, but not severe as states like Oklahoma. So some facts on coronary artery disease, which is what this map is kind of showing, is that 1 in 20 adults, that's 20 plus, ages 20 plus have coronary artery disease, and 2 in 20 deaths are from people less than age 65. So those are 2021 statistics. Um, kind of crazy stuff. This is something that really affects our country, so it's really important to know like all the telltale signs and differences of these things, because some of this stuff is pretty preventable. Risk factors, you have obesity, um, diabetes, inactivity, um, poor diet, and alcohol use. Going on to acute coronary syndrome, ACS. There's two different types of this. So you have unstable angina, um, non ST elevation, myocardial infarction, which is NSTEMI, and then you have just STEMI. But we're really going to focus on just it in general. So it causes chest pain, which can be described as aching, pressure, tightness. Also causes some nausea, um, dyspnea, and just sudden heavy sweating. Um, so it's caused by buildup of plaque, which is also known as arthrosclerosis, um, and this happens after it tears or splits open. Um, so, going on to acute myocardial infarction. That's when the heart muscle begins to die because it's not getting enough heart flow. And that's from the same causes I just said, because plaque builds up, it blocks blood from being able to flow throughout the body. Um, Chest pain sometimes radiates the shortness of breath. And I think a key one you should know that might be quizzed on for the exam is that for women specifically, you'll see the symptoms of nausea, lightheadedness, dizziness, fatigue. So those are signs of an AMI that you should be aware of because they're different from men. So these are just some pictures that can illustrate it a bit better. I think the one on the right illustrates it pretty well. You have plaque, a blood clot, and when it goes through, blood flow is decreased because there's not enough space for it to go all the way through. The other kind of thing that we're going to talk about is angina pectoris. So there's two different kinds of angina. There's stable at the top and unstable, which is right under it. So stable is more common. Stable is caused is an onset after exertion. So if somebody's exercising or going for a run, um, they might have some chest pain, and that can just be resolved by rest. Unstable, on the other hand, has a blood clot instead of just a plaque from arthrosclerosis, and it's a lot more severe and might not resolve entirely with rest, and it lasts a lot longer. Um, it doesn't, you don't really need to be working out or anything for that to happen. You just be laying down and it happens. So that's a lot more severe. The symptoms of this squeezing or crushing chest pain, might see some radiation, really depends. Shortness of breath. I forgot to explain. That's what dyspnea means. Um, and I put sudden onset. So with stable and unstable, they both occur with sudden onset. Okay, so we're going on to like the steps of just evaluating a patient when you go on call. So the number one step is to make sure you have proper PPE and that you're sizing up the scene. So I guess scene size up comes before um, PPE, just making sure that you're safe and that it's safe to enter this scene. So like carrying a knife, you don't really want to approach them because that might turn into a bad situation. So if that's happening, call law enforcement. If there's something like nuclear spill, you want to park upwind, uphill, um, so that stuff doesn't blow on you or fall on you. Um, and you want to make sure that you're wearing the proper PPE. Like if there's a disease that can be airborne, we'll go through that in some other slides, um, not in this lecture, but in another one. Um, you need to wear a HEPA mask to make sure that you don't breathe in any of those particles. So yeah, these are really the other steps of seeing size up. Um, I don't really got much else to say on that. Um, uh, After you go on scene, you want to conduct a primary survey. So it's really all these steps. Um, I kind of just put a note form. I don't really have much to say on that either. So yeah, feel free to steal my notes. Orientation levels. So back here, um, it says determine loss of consciousness or level of consciousness using AVPU. So AVPU, it's monodic, um, and the orientation levels. You have AO times 1, alert and oriented times 1. You're oriented to the person. Number 2, you know the person and the place. Number 3, person, place, and time. Number 4, person, place, time, and situation. So I was a bit confused on understanding these before I found this graphic, and I think it just puts it in a good context to see the different levels of alertness and orientation. After you do the primary assessment, um, you can go into sample history. So this is just asking people um, all these different things to just figure out their chief complaint and how you can best treat them. So their signs and symptoms, allergies, medications, past medical history, last oral intake, and the events leading up into today. So if this person has pain, you can get their history by asking these following things. Um, so these are different ways that AED can be applied. Um, the left is to adult, and the right is to infant. And if the infant isn't big enough for you to put the two on the front, you can put one on the front, one on the back, so the pads don't touch. So if somebody has a pacemaker, the AED pad is just put over the pacemaker. Um, you don't need to move anything, put it on the other side, just put it right over the pacemaker, um, right below the pacemaker. Patches, though, you need to remove those, so make sure to use a glove or PPE, and remove all the medication if there's any medication left. Um, so when you put the AED on, the only shock if it's ventricular fibrillation or ventricular tachycardia, VFib, which is the most common cause of a cardiac arrest. Um, can be best defined as a heart seizure. It's when the ventricles quiver rather than the actual distinct contractions. And VTAC is when the pacemakers rapidly fire. So boom, 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 instead of boom, boom, boom. That's what that means. So, and when you put an AD on, it's unshockable if it's um, asystole or PEA. And PEA is when the electrical activity is too weak to shock. Asystole is a cardiac flatline, so there isn't any electrical activity. These are the steps. Um, I think it's important to note that for one rescuer, you do 30 to 2, and then for 2, you can go to 15 to 2. That's something that might be on the test. Jaw thrust maneuver is definitely on the test. Um, that's just for any spinal injuries or if you suspect that there is a spinal injury. This may be on the test. Um, Make sure to put a pad behind children's shoulders when you're giving them CPR, because they're just younger, and without having that pad, they don't have enough support when you're doing the CPR. So yeah, these are just the different steps. It could be helpful for practical hypertensive emergencies. So we already covered AMI, which is a type of hypertensive emergency. The other two types are aortic aneurysm and dissecting aortic aneurysm. So you can see what a normal aorta looks like on the left, and in the middle, you can see what the aneurysm looks like. So this is a balloon-like bulge in the aorta, and if this ruptures, only 1 in 5 people will survive something like that. So it's 4 to 6 times more common in men, and it again is caused by arthero, atherosclerosis, narrowing of arteries from buildup of plaque. And the dissecting aortic aneurysm, which is shown on the right, it's not really shown very well. I couldn't find a very good picture for this, but that's when the wall of the artery itself is torn. And it's not as common as the normal aneurysm. It also occurs mainly in men, this from the a bit older age, from 60s to 70s. The telltale sign from it on the test is if you see the word ripping, because that's what it's often described as, a ripping chest pain. What results from this is loss of consciousness, a shortness of breath. It's very similar to stroke symptoms, and you'll see a weaker pulse in one arm versus the other. That's also a very big sign that you might see on the exam. So, hypotensive is the blood pressure is 180 over 120 or over. High is 140 over 90, so you can see that hypotensive is even bigger than just a high blood pressure. It's a lot more than that. And normal BP is 120 over 80. So different types of medications that you can use to treat these things. For anginal chest pain, you can administer nitroglycerin, and this is usually when the blood pressure is over 100. So for systolic blood pressure is over 100. So you can administer up to 3 tablets, one every 5 minutes, and they should be at the dosage of 0.4 milligrams. SL means sublingually, so by mouth, as you can see that picture. And this is the dosage for adults. So a couple of the reasons that you should not give nitroglycerin is up to 40 hours after taking erectile dysfunction medication. So this might include Viagra, Cialis. I didn't really write down any others because those are the main ones that they would use on the test. Another note-taking source I used said up to 24 hours, but I'm pretty sure it's up to 40 hours last time I checked. Another contraindication is if the person is hypotensive. So this is systolic blood pressure less than 90. And obviously, if they have any allergies, don't give them the nitro. Another medication that you can administer, this time for cardiac chest pain, is aspirin. So this can be up to 4 of these 81 milligram chewable tablets. And again, this is adult dosage. Reasons that you should not give it is if there's chest pain radiating to the back or the lower back. This could be this dissecting aorta that we just talked about, that could cause it to rupture, which, as I said, is really bad. Also, if they're taking blood thinners and allergies, so those are really good things to keep an eye out for. Make sure that your patient does not have any of those contraindications before you administer this medication. So I'll put this comic in here because when you're administering medications with great power comes great responsibility. FBOW, foreign body airway obstruction. So if this is present in the airway, the victim may react in one of two different ways. So they might cough or gag. You might hear some stridor. So they might still be able to breathe. They might still have an airway. And in that case, you just want to encourage them to keep coughing because they probably have the capabilities of getting it out. And if they don't, you might need to go to the hospital. Um, my sponsor family was at a wedding, and her husband has a narrow pharynx, so he sometimes gets this on accident, and he got a partial airway obstruction at the wedding, and they had to go to the emergency room because he was unable to cough it out. So in that case, just transport, monitor, make sure that their airway is open and they're able to breathe, um, and constantly reevaluating. In the other case, if they make this choking symbol, you just want to do the Heimlich maneuver on them. Come up from behind them and press down. Make sure they get that thing out. This is similar with a baby, but with only two fingers. So you do a chest thrust instead of coming up behind because that can seriously injure it if you go up from behind. That's just too much force for a baby. And if the baby is crying, in case of partial airway obstruction, you probably would still do the chest thrust because babies um, aren't really able to respond to, oh, keep coughing. They don't really understand that, and they might not have enough power to do it. So you might need to do uh, the chest thrust on them anyways. Um, like I said, back blows aren't always necessary. Make sure you check for adequate rise and fall when you're administering oxygen if it's needed. Um, and make sure that they have the capability of breathing. This was an interesting video I found. It's called LifeVac. It's a very cool device that saved countless kids from choking. And you just put it on top of their mouth, you push the thing in, it pops the little thing right out that they're choking on. So I think that's really neat. I think you should check that thing out. But yeah, that's my video. Those are all the notes I have so far. If you have any questions, just ask in the comments. Um, if I did anything wrong, also just tell me in the comments. Thank you.